All right, welcome everybody. It's just after 5:30, so we want to get started with our presentation from Brian Walsh with MedicareCU. I'll introduce Brian and then turn the time over to him. We'll also have time for question and answers. If you'd like to wait till the end, you can either raise your hand or type something in the chat box, and we can cover those questions, but we hopefully will have enough time to go over that later on. Brian Walsh is the Medicare broker for Clark County Credit Union, and he offers a no-cost program for our members to help navigate the challenges of Medicare coverage. He's worked with the insurance field since 1983 and now focuses on educating people on Medicare. He meets with our members one-on-one, helping them choose the plan that will best suit their healthcare needs. And now I'll turn the time over to Brian. He'll lead us through a presentation and then again, questions at the end. Brian.
Thank you, Shannon, very much. And I really appreciate all of you taking the time out tonight, especially when the NFL's playing. So we appreciate that very much. And I thank Shannon and Karen for organizing this, as well as Clark County Credit Union for allowing me to access their members, as Shannon mentioned, on a no-cost basis. And so we really do. We sit down one-on-one at the local branch near your residence, and we get to know you. We get to know what your healthcare needs are, so we can match up the appropriate plans for you, because these are very important plans that will be with you for the rest of our days. So it's very important to get it right up front. Why don't we go to the next slide, Karen? So we put together just kind of some basics. And what we'll do at the end of this, we want you to ask questions by all means and get into some of this. We'll try not to get in too much into the weeds, but give you a real good overview of the Medicare process. So as most of you know, Medicare, it is a national fee-for-service insurance program, and it's administered by the federal government, and it's a sub-agency of Social Security. So as you know, when we all go out to apply for Medicare, we've got to go through that ssa.gov site, which is the Social Security site. And what makes up original Medicare? Well, it's Part A, which is your hospital insurance, and Part B is your medical, okay? Together with those, that is called original Medicare. So who qualifies? So I have clients that are under 65. I have clients that are turning 65. And I have clients that are 90, 95 years of age. So it kind of depends. It's very individual, Medicare, and everybody's got kind of a different need. So I always kind of laugh when people talk to neighbors and they say, oh, you should try this plan or this plan. Every plan, there's not one plan that fits everybody because everybody's on different medications. They go to different doctors. And so, and they have different needs. Maybe they need transportation benefits or at-home benefits and those types of things. So who qualifies? So people that are turning age 65 or disabled. They need to be a U.S. citizen and a resident. And that's a lawful permanent resident that has a green card and has lived in the United States a minimum of 5 years continuously. And then you must have paid into the system, the Medicare system, for 10 years or 40 quarters is how they measure that with the taxes that we pay in. Now, some people don't pay into the system for 10 years. So if they're married, they can actually piggyback off of their spouse as long as that spouse has the 40 credits and has paid in for 10 years and the spouse is at least 62 years of age. So that's always good to know. So folks under 65, those are folks that are, they might have Lou Gehrig's disease, they might have end-stage renal disease, and they may be on Social Security disability for 24 consecutive months to qualify. So it's a very vast program that covers millions of people. So how do some people get Part A and B automatically? Well, if you are already getting benefits from Social Security or the Railroad Retirement Board, then you will automatically, at 65, you will receive a red, white, and blue card in the mail 3 months before your 65th birthday or your 25th month of disability if you happen to be on Social Security disability. Some people need to sign up for Part A and B, and it's very important. Some people don't want to retire at 65 and they will continue on their employer health plan, and that's perfectly fine. I've got people that are in their 70s and beyond that might be owners of companies that continue on with their employer plan. Now, sometimes they might have a spouse that is 65 and they might peel off and go on Medicare, but you don't need to pay for your Part B if you're continuing on with your employer medical plan. Now, there are some cases with people that might work for a company that has under 20 employees. And the way the rules work there is Medicare pays first when you're on a group plan under 20 employees. And so we always, when we sit down, we tell people, be sure and go talk to your HR department and see if they allow the coordination and the Medicare. So we're very careful about that. Right now, for 2025, the average, I'd say 97% of the people in America pay $185 per month for that Part B doctor side of Medicare. And that goes right to the federal government, to Medicare. And the other 3% of the population, there's a tax that people pay based on their income. And there's another slide in here that we'll go through, but just to boil it down, if you're going on Medicare this year, they go back 2 years to your 2023 tax form, and they look at your modified adjusted gross income. So for most of us, this doesn't impact us, but there are some people that are very high income, and so they pay more than the 185. Next year, it's not official, but it's expected to go from 185 to about 206.50. Now, Social Security is going up, maybe 2.5%. It'll cover that adjustment, but that eats up quite a bit of that increase. Okay. So I provided on the next page, Aaron. And then we'll go one more. This is what we call IRMA. It's the Income Related Monthly Adjustment Amount, or IRMA. And that's for people that have high income. So we can provide you with the chart when we sit down and we show people exactly what to expect when they apply for their Part B, so they're not surprised when they get a bill in the mail. Now, most of us pay that Part B right out of our Social Security benefits, so that's pretty slick. But for those that continue to work and go on Medicare, they will be billed on a quarterly basis. But you can see from this chart, it might be kind of hard to see, but if you file individual tax return and you earn, let's just go to the very top, 500,000 or more in income, that's modified adjusted gross income, you pay each month $628.90 from the 185. So you can see there's quite a surcharge for some of the higher income people. Next slide, Karen. So when can we first enroll in Parts A and B? So typically it's the 3 months before your 65th birthday if you decide to go off your employer plan at 65. So you have the 3 months prior to your 65th birth month. So let's say you're born on January 2nd, go back 3 months, you have the month of June, and you have 3 months after that to apply to be timely enrollees. Yeah. Some people forget to apply or don't enroll, and there can be lifetime penalties that are incurred. So we want to encourage people to make sure that if they continue on with an employer plan, that it's what we call credible coverage for both medical and pharmacy benefits. And typically employer plans are credible, so you don't have an issue with that. But some people think they can go on COBRA from an employer plan and that's credible coverage, and it is not. So we work with people through those situations. Next slide, Karen. Now, some people might get their red, white, and blue Medicare card in the mail when they turn 65, but they don't want to go on Part B Medicare because they want to continue with their employment, or there's some other coverage that's credible. So you can always contact Social Security and send that card back and tell them that you want to not participate in Part B at that time. And we help people with that process. Okay, next slide. Now, as we all know, there are two choices, two plans that we can apply for Medicare. And one is called a Medicare Advantage plan, and one is called a Medicare Supplement plan, or also referred to as a GAP plan. And you can see on this chart, this is actually the 2024 benefits I'm noticing, but nonetheless, we put this chart up to show you. You can see Part A, 2025, the deductible is roughly around $1,650. And Medicare does not have a deductible on Part A like our employer plans. We're used to calendar year deductibles. On Medicare, it's every 60-day benefit period. And so you go into the hospital, and then once you've exhausted the 60 days, they start a new benefit period. So you can see it, and then it starts a whole new deductible again. So people that are on original A and B with no Advantage plan or no supplement to fill in those gaps, it's very costly, and it can drive people to bankruptcy, frankly. So it's very important that people understand the two choices that they have. Now, the Medicare Advantage, I'd say right now, in America for 2025 estimates, there's about 62.8 million of us that are Medicare enrollees, and about 34.1 million are enrolled in Medicare Advantage plans. So it's just gone over the 50% mark. These plans are becoming very popular in certain areas. And so they expect those plans to continue to grow. But there's big differences, and there's not one plan that fits all. So let's go next slide, Karen. So the Medicare Advantage plan is a private plan. And so you remember those premiums we send to Medicare, the $185 or more each month? The government then sends those monies to the private insurance companies like United Healthcare, Humana, Aetna, Cigna, Anthem, Blue Cross Blue Shield, and they put together these companies' Medicare Advantage plans. Okay, so these plans become primary. They include original A and B of Medicare. They include medical. They include drug coverage. They include dental, vision, what we call over-the-counter benefits, pain relievers, toothpaste, soap, anything that you can buy over the counter. And we're starting to see some over-the-counter items are actually some food items. And so these plans, typically in Clark County, they have zero premium. You still got to pay your $185 for your Part B, but you got zero premium. And people like it because all their plans are in one bundle for zero premium. Now, you do have to pay co-payments and deductibles as you go, as you incur healthcare costs. So that's going to be one of the big differences compared to a Medicare supplement. The other difference is these plans are tied to networks, HMO and PPO networks. And we all know health maintenance organizations, preferred provider organizations. We're lucky here, we have good networks. In rural areas, not so much. And that's kind of the rub of what's going on across the country. Now, these Medicare Advantage plans, they can be terminated if the companies are not making profits. And in 2026, there's going to be across the country in Florida, Florida, Indiana, New York, there's going to be a lot of Medicare Advantage plans exiting the market because they are not making a profit. The post-COVID, the Inflation Reduction Act, which put a cap on pharmacy cost of $2,000 this year, has cost shifted quite a bit of those dollars to the insurance companies. And so they're really, some of them are struggling now. The three major companies, or four, United Healthcare, Humana, Aetna, Cigna, they've been around a long time and they've weathered the storm. Some of the new players to the fold they're going to be out there this year for 2026 trying to get people to buy. They're going to have all these goodies, more dental, more over the counter, but we're just trying to be very upfront with people and tell them, make sure you're confident that these companies will be around in the next 5 to 10 years. So I know it's hard to guess on those things, but that's where the agent comes in and broker. Okay, now the Medicare supplement plan is medical only. So it does not come with drug coverage. It does not come with dental, vision, over the counter. It does come with some gym benefits, which is good, and some discount dental and vision. But it's really a medical plan that fills in those gaps of original Medicare A and B. And that plan is based on your age, your zip code, your gender, and it can run roughly here for 65-year-olds in Clark County. It's about $215 or plus. And for females, it might be about $195 plus. So that's just your medical. And then you still have your $185 for your Part B, right? Then you got to get a drug plan. And those are standalone plans. There's some real good ones on the market, but those are going to be going up quite a bit for next year. So it's real important that if you have an agent, make sure that they shop that drug plan for you for 2026. Because as you maybe go on to different medications, these companies, they change their formularies or the list of drugs that they pay for. So it's good to shop around. You definitely don't want to shop your Medicare supplement, right? You want to hold on to that. Now, some people downgrade their supplements because of price. That can occur, but most people hold on to that plan because of the value of it. Now, Medicare supplement plans have no network compared to the Advantage plan. So you can go to any doctor or facility in the United States that accepts Medicare. That's pretty powerful. They cannot be canceled as long as you pay your premium. They are offered for the lifetime. Okay. So those are big deals. They also do not have referrals. And a lot of them, you just go right to your doctor that's with Medicare and you receive your treatment. A lot of them don't have prior authorization, so you don't have to have an insurance company approving those processes. However, for next year, in some states, they've passed laws where the supplement carriers will be doing prior authorizations. So that's actually a good thing, just to make sure that people are not, abusing the system, and that if they really need a procedure, that they get it. Okay. The Medicare Advantage plans on the HMO will also have a gatekeeper, right, or a primary care doctor. You don't have a primary care doctor on your Medicare supplement. However, most people go to a primary care, but they don't need to refer you to a specialist. So there is no referrals required. Okay. So basically, Medicare supplement, you pay up front each month and you pay very little on the back end. This year, the deductible and out of pocket on Part B is $257. Well, you can meet that in one visit in Clark County. And so very advantageous for folks that can can keep up with those payments each month. Now, a lot of folks do very well on the Advantage plans here that are maybe lower. They don't have the money or the cash flow to do the supplements, so it works well for them. But it's nice to have options. Okay. Also on the supplement, you need to get standalone dental, vision, and hearing plans, and we market those, as do other brokers. So those are all standalone apart from the medical. Okay. So basically that's in a nutshell kind of the overview. I wanted to also tell you folks, I know there's a lot of scamming going on out there with emails and texts from Medicare type folks, and just be very careful not to answer those because I've had some clients that have gotten calls from, unfortunately, people that, and some of them agents, trying to switch their plans to get a commission, and to find out their doctors don't even participate in that plan, and things like that. So you just got to be very wary of that. Always make outgoing calls to your broker and to the companies direct. Do not accept incoming calls unless you have a prearranged call coming in from a carrier that you know, and you know their number. So for that, why don't we turn it over for any questions or comments or what you might have on your mind, and we really thank you for your time tonight. Are there any questions? Can you refer an excellent broker? Well, let me tell you this. You folks online, I'm sure some of you have a very good broker, and I always say that is great. Make sure you stay with that broker because loyalty is everything. And as long as they're doing their job and they don't represent just one company, they represent not all of them, but the national players and enough companies to help meet your needs. Stay with that broker. But if you're not happy with your broker, we'd be more than happy to set an appointment and sit down with you at one of the local branches and get to know you and help you out. Okay, Catherine, let's see. I'm a veteran. I'm glad you brought that up. There are specialized Medicare Advantage plans for veterans. And typically veterans will use the VA for their medications. But a lot of veterans want to go outside too, to other facilities or doctors or specialists. So by getting a Medicare Advantage plan, you can actually work in tandem with those, like TRICARE and those type of things. It works very well. It also provides what we call a Part B give back. And I want to tell you folks about that. Some of you know about it. That Part B give back, some companies on these plans will give you back up to $125, $140 off of your $185 Part B premium each month. So that's pretty attractive. But typically, they've taken away some other benefits on the plan. So as long as you measure those, if you're relatively healthy and you can afford the co-payments and deductibles, then it's kind of nice to have that Part B reduction.
I have a one raised hand, Brian. Let me just turn on their mic. Dale, you can speak now if you want.
Hi, Gail. I don't know if Gail's muted or.
Yeah, I mean, he's unmuted now, but we have one question came up in the chat. So while waiting for Dale, from Roy, he asked, what if you're a disabled veteran with full medical coverage?
What if he's a veteran with full, he's age 6?
A disabled veteran with full medical coverage.
Yeah, so you can get on these. There are some plans for veterans in that with that situation, and that brings up another thing. There's specialized plans out there for chronically ill folks. They're called chronic special needs plans. These would be people that maybe have heart, diabetic issues. These plans help pay for the medications. They usually pay much more than the other plans. So that's another thing I want to let people know. You may be at 65 to 70, healthy, going along on just a regular Medicare Advantage plan, but maybe your health changes and you have a chronic condition. Make sure that you look into these chronic special needs plans and that you have your broker look at that. The other thing is if you are on some folks are on Medicaid and Medicare, then that's called a dual special needs plan. And that's when you get into um, Medicaid and Medicare coordinate. So a lot of your premiums are paid for, your copays, your medications, and they give you also what they call healthy options, groceries, money for rent, and utilities. Now, just a caution for next year, they're going to make people show that they have a chronic condition before they are eligible for some of these grocery benefits. And also, if you're taking any of those monies for rent or utilities, Housing and Urban Development, HUD, is going to consider that as income. So we want to caution people. We don't want them to lose any benefits under HUD. That's something else that you want to make sure that you're careful, you consider when going on some of these plans.
Okay, I'm not sure if Dale is ready, but Dale, if you already have your mic unmute, you may speak now. Dale? Oh, I guess it's still not ready yet, but I have another question that came up. How can I sign up for Medicare A and B and C?
Yeah, so that's through a broker like myself, and we help folks sit down and we go onto the ssa.gov site and we enroll for Medicare and help you with that. Now, some folks don't want to do Social Security, they just want to do Medicare. So we help them with that. And then maybe down the road, they take their Social Security benefits. So that's a service that we do provide for you.
Okay, and another one. Will the premium amount you pay each month change each year based on your prior year income?
That gets back to what we call the IRMA, the income related monthly adjustment amount. So you're right. Like for 2025, they go back to 2023 income tax statement. So for 2026, they're going to look at 2024 and they're going to look at any kind of capital gains that people might have from the sale of homes. But there are situations where they're just one off. Maybe folks are, got a large payout or something. And so there's ways to work with Medicare to sometimes appeal those decisions to surcharge you. So we help with that as well.
Okay, and another one. So if they travel out of state or internationally, will their Medicare plan still cover?
Great question. So on the Medicare supplement, there is a lifetime benefit. One of the carriers has a 50,000 lifetime benefit for emergency coverage outside of the United States. The Medicare Advantage plans, they also have an emergency benefit, but they're going to just stabilize you and get you back to your service area. I always tell folks if you're going to travel abroad, and especially this happened during COVID, people need to take out those travel policies. Very important for if you ever need to be air vac back or, it's basically an emergency room in the sky. It's very expensive, and a lot of those travel policies will help pay for that. So we encourage people to do that.
Okay, we have a question from Janet. What are the FMG plans?
FMG.
F and G plans for Medicare.
Oh, very good. So that's a great question. So if they couldn't confuse you more, the Medicare supplement plans go from A to N alphabet. And the plan that we recommend today is Plan G. Plan N was stopped back for those turning 65 before 2020. So some folks might still be applying for Medicare now that were born, that turned 65 before 2020. So they still have that option. But the difference between the F and G, we go through that with them, is basically the F picks up the Part B deductible of $257. And then there's some other minor differences, but we show them what the premium is, and then we show them what the advantages are. And most people want to go with the Part G because the Plan G, because it's got a healthier pool of business. Remember that F pool is full of folks that are aging, and there's a lot of claims, but it's a very good plan. But we recommend G. Now N, and then there's N is the other one that puts co-payments on office visits. It also puts in some usual or like if doctors charge more than Medicare allowable, there's some penalties there. But we go through that with you and show you exactly what the differences are. But basically, they try to, it lowers your premium. There's also G plans with high deductibles. So folks can lower their premium a bit that way. But people buy the G for the low out of pocket, and they want to be able to budget with their health care. So great question.
And then here's a question from Dale. He says, if I'm 65 with insurance through my employer and my spouse's employer, do I still need to sign up for Medicare?
Okay, that's a really good question. So if he and his wife are going to continue working and being covered under their employer plan, in other words, they're not going to retire, right, at 65, they're going to keep working, then they do not need to sign up for Medicare. However, if they're working for a company that's under 20 employees, we do caution people, and typically we do tell them that you need to sign up for A and B. But that's where we sit down one-on-one and just get their exactly what's going on. Sometimes one spouse is older than the other spouse, and so that older spouse has to stay on the employer plan, because if they went off that plan, their spouse would lose coverage. So, and their children. So you got all these things going on, and you got to make sure it suits your needs and your family's needs. So great question.
And also from, sorry if I don't know if I'm gonna pronounce your name correctly, but Juta. She says, I have a partial disability through the VA. Is there a plan that is different for me?
So is she under 65?
I'm not sure.
Yeah. So if she's under 65 and she's on Social Security disability, there is a Medicare Advantage plan that we can market for folks like that.
Okay, and another
I
question.
kind of need to know quite a bit more of the facts on that situation, but there are different plans for people that are on Social Security disability for more than 2 years.
Okay, they said they're turning 65 next year and they're not on Social Security right now.
Yeah, so if they're going to retire next year at 65, and let's say their birth month is June, then they would want to get a hold of an agent broker 3 months prior, so we can start that application process for Medicare. And that's what we do. We like to get at least a 3-month jump on folks that want to take out Medicare at 65. Because it takes Social Security a while to get everybody on those plans. It takes a couple months sometimes. A lot of people turning 65 these days.
Okay, so we have a couple of questions. How can they set up an appointment with you?
Yes, you can call me. I'll give you my number. It's 702-903-9787. And that will ring right to me, and then we can make an appointment and sit down at the local branch nearest you. I would welcome that opportunity. Thank you.
Brian, do you want to mention that you will be in branches coming up for open enrollment, and we will share those dates as well?
Yes, thank you. So the annual enrollment period, this is for folks that might be on a Medicare Advantage plan and they want to change plans, or some people are just on original A and B Medicare and they want to apply for plans. That runs from October 15th to December 7th, and those plans are effective January 1 of next year. So we're going to be at all the 6 branches. We're kind of rotating, as Shannon mentioned, there's a schedule. So I'd be happy to meet you folks at that scheduled appointment that week where I'm at a branch.
And that kind of answers the other question. Are you part of Clark County Credit Union? You want to answer that, Brian?
Great. I am not an employee of Clark County Credit Union, so I'm an independent Medicare broker. And I have been with Clark County Credit Union using their services for about 30 years. And I approached them to see if I could access their members. And so we worked out a deal. And what's great about this is the members do not pay a dime. And I get paid from the insurance companies. So it's really a great value added service for credit union members, their families, and even friends.
All right. Well, I don't see any other questions here, but Brian is definitely available. The number you see on the screen there for follow-ups. And if anyone wants to reach out and set up an appointment, he, again, will have time in the next coming weeks to be in our branches, but also he can schedule independently of those times as well. So thank you so much, Brian, for being here tonight and answering these complicated questions. It seems the theme of this is it depends. There's lots of options and lots of variables here. So we want to make sure we help people get their answers.
That's right. Well, thank you very much, Shannon, Karen, and thank you all members out there. Great questions. And I look forward to meeting each one of you and talking about your Medicare needs. Have a great evening.
Good night, everyone. Thank you.